So welcome to another webinar from New York Theological Seminary about ministries and life under COVID-19. Today we're with Holly Bonner, who is currently a Doctor of Ministry student at New York Theological Seminary, and she has a fascinating and unique ministry to mothers, and under COVID-19, he has expanded to things that she, like all of us, right? Things that we did not expect we would have to be doing. So I hope you learn and are inspired by this webinar. So Holly, welcome to the webinar.
Hi, thanks so much for having me. I really appreciate being here.
Tell us about yourself, your background, how you came to be where you are today.
So I live in Staten Island, New York,
Mm-hmm.
and I've been here for about 20 years. I have been diagnosed with breast cancer when I was in my early 20s. And through much of my 20s, I kind of bounced in and out of remission. You have to remember that this, when I was first diagnosed, was about 1999. So the overall treatment for somebody that was 19, 20 years old at the time was very different than maybe the treatment that you would get now in 2020. So my doctors recommended a course of chemotherapy and radiation, which I had done, and it did help me get better, but only for a short amount of time. And throughout my 20s, as I would get well and then get sick again and get well, I tried a lot of different chemotherapy drugs in the cocktail that I received. Unfortunately, at the age of 26, one of those drugs had a 2% chance of impacting the optic nerve of the eye.
Mm-hmm.
And what ended up happening is we took the chance because the percentages of 2% was relatively low. And I ended up becoming legally blind. So I have no vision at all in my left eye. And in my right eye, I have what's called 2900. So I can basically make out your shape. If I get very, very close to you, I may be able to see more definite features. But it was a life-shifting disease to go through. And having been a sighted person and then to become legally blind was absolutely devastating. That being said, throughout that bulk of time that I was battling cancer, life went on, right? You know, so I married my my husband, and I ended up getting a bachelor's degree in human services. My first master's degree was in public administration. And then I got my second master's degree from Columbia University School of Social Work in 2010. After I lost my eyesight, I really think that faith in general shifted for me. I had to find a reason and a spiritual reason to really keep going. And I had a lot of very, angry conversations with God. I was born and raised a Catholic, and everything that I had been taught appeared to be a lie. I just did not understand why my life had been filled with so much suffering. I would joke with my husband and tell him that if God and I had a relationship status, it's complicated. That's kind of how I felt, and at my darkest point, I would say it was probably about 6 months after becoming legally blind. In prayer, I had said to God, "You got to give me a sign that you're here. I need to know why I'm still around, because I was pretty close to ending my own life and had considered suicide on many occasions. This particular occasion, I really thought I was going to go through with it. And I ended up getting very ill towards the end of the prayer, and told my husband what had been going on. And he took me to the doctor the next day to have my mental health evaluated, and also to see what doctors could do for me, because I was, not feeling well. And it turned out that I was pregnant. And the doctors had told me that I would never have children, that was not in the cards. So that was my answer. That really was. And I always say that my daughter, who's now 7, really saved my life, because after finding out I was pregnant with her, that gave me the push that I needed to, get on track. And when you become legally blind, you have to relearn everything. So I had people that in New York State, they assign you to a case manager with the New York State Commission for the Blind. It's all free funding. And they basically come to your home and reteach you everything: how to make a sandwich, how to boil water, how to do your laundry, how to cross the street. This was very upsetting, you know, for somebody that had 2 master's degrees, was Ivy League educated, and now it's, you know, I'm going to teach you how to cross the street. I mean, it just didn't seem fair. But when I found out that I was going to be a mom, that all went out the window because I had a baby that I had to take care of, and the baby was coming. So it really put me on a good path, and I thank God for that every single day.
That's amazing. Wow. And just from our distance, getting to know each other, you strike me as the take charge and, you know, get things done type of person. So I'm sure it was especially challenging when you were unable.
I am a type A control freak. Yes, I am. I'm a total New Yorker. I really am. But yes, it's very difficult. I don't like being told what to do. My husband will attest to that. So, but yeah, it was hard, and but it was humbling at what, you know, and maybe I did need to learn that. I think I did need to learn some humility, you know, and to learn that you don't always have all the answers, and you can't always be in control, because that's faith, right? You
Yeah.
can't control all the time, you know. And I know many people right now in these circumstances, you know, certainly feel out of control. And we're on God's clock, and we're on His time, not
Yeah.
our time. So yeah.
Tell us a little bit more for those of us who've never had to go through that process of learning how to live life as a visually impaired person, right? What was that process like? Yeah, when that person came to show you things, right? What was it like, and what, you know, are there special machines that you needed and technology that you needed to be able to get through life and do
Yes.
what you used to do?
Yeah.
Tell us
So,
more about that.
well, I mean, you know, one of the problems that I faced is in Staten Island, there were no dedicated nonprofit organizations just specifically geared towards the blind. So everything that I needed was outsourced from Manhattan.
Mm.
So the first thing that you really need to learn is something called orientation and mobility. So that is a white cane. And many people, you know, will see a blind individual walking with a white cane, and at the bottom of the cane is a red piece of reflective tape.
Mhm.
That reflective tape is meant so as you're crossing the street, if a car is coming, that they will see you. But
Mhm.
to go from using your eyes to crossing a street and to now having to use your ears, it's a very daunting task. I mean, it definitely is scary. You want to talk about lack of control, you know, try crossing a busy street, you know, around 3 o'clock when the school buses are out, and see if
Mm.
you can get to the other side. And you also have to put your faith a lot in drivers, which in New York City is no easy task, to say
Uh-huh.
it, you know, plainly. So that was the hardest part.
Mhm.
And you know, thankfully I had an excellent teacher who in the beginning I quite frankly gave her a very, very hard time. I was very angry, and you know, there was nobody but my husband to take it out on, and her, and she got the brunt of it. And to this day, we are really good friends. And I
Mm.
thank God that I had her, because she did not put up with me, and she gave me back my independence. I now use a cane, but I also use a guide dog. I have a guide dog named Francis. In order to receive a guide dog, you have to have at least 1 year or 6 months really to 1 year of this orientation and mobility training, and
Mhm.
the teacher has to sign off on it. You can't crawl before you can, I can't walk before you can learn to crawl, right? So
Mhm.
with the cane, it's kind of like those steps to the guide dog. So
Mhm.
that was one professional that came. Another professional that came was a technology specialist. And they basically looked at all my computer equipment. And I was
Mhm.
working at the time as a social worker, and kind of assessed what would be the best, most accessible devices for me. I pretty much use all Apple products because
Mhm.
their built-in accessibility is phenomenal. And I have 2 programs installed on my computers. One is JAWS, and the other is Zoom Text. Both of them are magnification programs, which are fabulous, and they help me look and read, especially in a DMIN program, a lot of biblical text.
Mhm.
Um, you know, and the other person that came is an adult daily livings instructor.
Mhm.
And what she did was really stuff that was in the home. So to have another woman come into your house and kind of rearrange your cabinets, you know,
Mm. Wow.
and you know, move your pots around.
Mhm.
Again, she bore the brunt of the wrath of myself for quite a while. But you know what? Everything that she did was in my best interest. And
Mhm.
when I let go and let God and understood that she was there to help me and to help me be a better wife and eventually a better mother. I learned some invaluable
Mm,
life skills from her, as well as life lessons,
mhm,
about letting people in and letting yourself be vulnerable.
mhm. Tell us about the ministry you started, right? The Blind Motherhood Ministry.
Yes. So, when I found out that I was pregnant, I kind of scoured the internet and I really was looking for another blind or visually impaired mother that
Mhm,
was in my same boat, that was maybe pregnant or expecting or had gone through the process already. There was nobody. And I had said to my husband, I said, this is so frustrating because it wasn't like I could pick up Parents Magazine and look for the answers,
mhm,
right? They didn't have the answers at that time. So I said, I'm going to start my own blog. And it started out as something quite small. I started contributing to some of the major parenting sites, like The Mighty and Scary Mommy, Today's Show. And a
yeah.
lot of my writing was getting picked up because it was a completely new perspective. It
Mhm,
was something that people, quite frankly, were a little uncomfortable with. The idea of somebody who was legally blind with limited sight caring for a baby.
mhm,
My goal was to show them that it could be done. I'm going to make mistakes, but these are the steps to kind of get me to where I need to be so that I could feed my child, diaper my child, take my child to the pediatrician.
mm,
And then what ended up happening what I didn't expect was that there were a lot of blind parents who were reaching out to me saying, wow, thanks for shedding a light on this. Or, blind teenagers that said, I never thought that I would be able to be a mother, but
mm.
now I see you and I know that I can be one. And what a gift, right? What a gift to
Yeah, that's
be able to
beautiful.
see
Mhm,
that. Yes. And the biggest, I would say the biggest shock that I had was a lot of doctors who were in pediatrics that were, especially in South America, because South America really does not have the resources that the United States has for people who are blind and visually impaired. And
mhm,
I would get doctors who would send me messages in Spanish that I would then have to have translated. And
mhm.
that led to me making videos for these physicians to try to help blind parents or blind couples better take care of their children with some of the kind of home modifications I had done in my own home for parenting.
Yeah. So tell us what before COVID-19, right? Tell us what your average day looked like for Holly Boner to get up in the morning in 2019. Let's say August of
Well,
2019. What was an average day or week like?
my days have always been busy, not to the extent that they are now, but
Mhm,
thankfully, since my losing my eyesight and since my daughters, now have two little girls, Nula is 7 and Aoife is 5. Since my oldest has been born, I really have worked from home. And aside from Blind Motherhood, where I do make a little bit of income, I am the Staten Island Borough Coordinator for Vision Services for the blind and visually impaired. So I
mhm,
do a majority of the fundraising and kind of grant writing for
mhm.
that New York City organization here. I'm also an adjunct professor at Wagner College and Metropolitan College of New York, so I do a lot of teaching, here. So an average day is my day usually starts at 6 o'clock. I let the guide dog out in the backyard to do their business, and then it's off to make breakfast for the kids and pack lunches and get them up and get dressed. That's a process in itself. My husband works the midnight shift, so he does not usually come home until around 9:30, 10
Mhm.
o'clock in the morning. So on the days that he is home, he would drive the children to school. But on the days that he wasn't, I would have to get them to school via Uber. So I would Uber them to school, Uber myself home, and then I start my job here, working in the house. I try to get as much of my work responsibilities done while my children are in school so I can give them all my attention when they come home. And in between, if I take a break, it's usually to do laundry or vacuum, some type of housework. I try to get a blog in or some writing done at some point during the day. And
Mhm.
then by 3 o'clock, it's time to get them,
Yeah.
and then home, they get their showers, everybody's cleaned for the day, another load of washing, do homework, get dinner started, bedtime stories.
Mhm.
My oldest child has a severe form of dyslexia, and she does need some extra help. So much of my time with her is really spent working on some more. They use a program called Orton Gillingham, which is a more tactile type program to
Wow.
help her learn her letters and her spelling.
Mhm.
So I do some time, with her with that, and I have to give her that attention. And then put the kids to bed, and I'm usually up till 12 or 1, still finishing up additional, work requirements that need to be done. So it's a long day. I mean, 14, 15-hour days. And in between, I do get the demon homework done too, but that's gotta get that in. But it's difficult. It's
Mhm.
definitely hard.
Yeah, I always like to ask people about before and after COVID, right? Do you remember when you first heard that there was this virus and it was some type of cold, and what did you think it was going to happen? How did you react to it? And then obviously, I don't think any of us expected what we're
No,
experiencing now.
I
But
don't.
what did you think when you first heard about this?
I have I was raised by my father's from Argentina, and my father was always a prepared person.
Okay.
He, even when we were children, if there was a snowstorm or if he was going to fix something in the house, he always made sure that he went to the umpteenth degree to prepare and do it properly and do the job done. And I think a lot of that comes just from his immigrant background.
Mhm.
So I've always been a preparer. So I always have extra in the house, extra canned goods, extra cleaning supplies. The other part of that is, since I've lost my eyesight, I don't really have the luxury of getting in a car and going someplace to get what I need to get.
Mhm.
So if there's a snowstorm and I don't have the elbow macaroni that my youngest will eat, she's not going to eat. So
Mhm.
I have to make sure that I have what they need. So when I first heard about COVID, I saw that a lot of people were really downplaying it. I don't think the community at large took it seriously. I
Mhm.
remember taking my children to robotics on a Saturday at the local YMCA very close to our home, and I brought a container of Clorox wipes, and I would do my homework as the kids were in class, and I wiped everything down. I remember people staring at me, and
Mhm.
I'm thinking to myself, they think I'm nuts. That's for sure. But I have to be more vigilant. Having had breast cancer, and I currently have bladder cancer, and I'm taking chemotherapy medication for it now, but it's oral. I have to be vigilant, especially
Of
during cold and
course.
flu season. So I took it probably more seriously, I think, than most people would. But I have to say that my doctors did not push the panic button until the end of February, beginning of March.
Mhm.
That's when I kind of got told, try to limit where you're going and think about possibly, if things get bad, taking the children out of school.
Hmm. Wow.
Yeah, and that's been an issue. Taking them out of school. And in fact, we had our demon residency in February, and because I live in Staten Island, I stay at International House, which is about a block away from the seminary.
Mhm.
It's where you can, rent an apartment. They have people that are
Yeah.
from all over the world that stay there.
Mhm.
You're really getting, any type of person that you can think of from any nationality is staying there. And I remember feeling kind of nervous at that time. And that was the second week of February. I wasn't wearing gloves and a mask, but I was being more vigilant about the hand
Mhm.
washing, hand sanitizing. And I could see that there were people staying there that had the masks on already. And,
Mhm.
and not just people from, Chinese or Asian descent, but there were quite a lot of people, that I saw, African American people, white people that had these masks on, and that kind of got me a little concerned.
Mhm. Mhm. By the way, before we go on, did you know I'm from Argentina?
No, I did not.
I'm from Buenos Aires.
Oh, that's where my father's from. There
Wow.
you go.
Whoa.
That's it. Yes, he is. And it was funny because I had told you I just did a radio interview at Vatican News, and I remember when Pope Francis was elected and how happy my father was. He was thrilled.
Yes.
another
Yes.
another person from Argentina. I have never been. I have always wanted to go.
Really? You
But
never visited when you were little?
no,
Oh,
not
yeah.
when I was little. No, mm-mm, no. When was
Yeah.
the last time that you were there?
I'm sorry?
When was the last time you were there?
2018, summer of 2018. That's when I took the kids and yeah, the whole family. We went back. But I used to go back at least once a year, once or twice a year because of work. I have research projects out there, so
Oh,
I go
nice.
back more often. But
Very nice.
wow, small world. So tell me how, yeah, to now, right, post COVID-19, now that your husband can't come in anymore, right? He's had to essentially move out. Yeah, what is life like now under COVID-19?
I mean, COVID-19, I think, has just flipped the whole world upside down. My husband has 24 years on as a New York City police detective, and has been very dedicated to his job. Never took a day off sick, in those 24 years. And we had the conversation that if, God forbid, he should come in contact with somebody with COVID, what would we do? What ended up happening is the people that he works with, his fellow employees and fellow officers, were getting sick. And he just said, this is too dangerous. I need to leave. So he ended up renting an Airbnb relatively close to the house. And he comes in the morning after his shift at 8:30. I have his breakfast waiting for him. He picks it up, says hello to our kids through the screen door. And then he usually comes back around 6 o'clock. I give him his dinner and I give him a sandwich to, take into work, because where he works in Times Square and where he patrols, nothing's open. So there's no, going into, a 7-Eleven or anything like that, in his precinct. As far as the kids, you want to talk about long days, I now get up at 5 o'clock in the morning because I need to work from about 5 to 8:30 to try to get anything accomplished. And when they do wake up, around 9:30, 10 o'clock, I feel like most of the day I spend pulling them physically apart because they want to choke each other. They're getting on each other's nerves, and, they're in the house, and we are very blessed that we have a home and we have a backyard. But, they're 5 and 7, and their daddy is gone. They're not understanding why daddy is gone. They're very afraid of the virus. I try to keep the news off as best I can, in the house. And trying to do schoolwork with them, especially with a child with special needs. It's increasingly, it's very frustrating. It really is. I do the best I can. I pray daily for patience. I don't always, reach that expectation that I have of myself as a mother. And I've made a lot of mistakes since they've been home. And I think that that's okay.
Yeah.
But it's, I'm definitely trying as best I can. I actually have here, you can bring it to me. I have one here now that just woke up. Say hello to Tony. These are my girls.
Hi, girls.
And this is Aoife.
Why does it say
Brian?
Brian?
That's
And
another
these are communications.
Brian's not there.
Nope, he's not there. Okay. So mommy's gonna finish taping with Tony, but you got to meet him, okay?
Okay.
All right. You
Nice
go
to
ahead
meet
and
you,
drink
girls.
your drink. Yes, go sit down. So this is it now. It's like, they wake up in the morning, you have to make sure that they have their breakfast, their meals. One of the most difficult things, and it really has impacted the blind community, is the shopping, right? We don't have the ability to jump in our car and go where we need to go. We also don't want to bring our guide dogs, if we are using a service animal, out into the general public, because people right now are so, focused on social distancing. We don't want the dog to get too close to anybody. We don't want their paws hitting, any public floors in any capacity for them to maybe track something into our homes. And to get delivery service has been, really difficult, to get anything delivered. What I have been doing, and I've always had things delivered, but Amazon is basically, just home goods, whatever you need. I've had to get creative with meat because I have not been able to get anything delivered. So I've been using websites like, Harry and David, which would be like a place that you would go to send somebody maybe a sympathy basket, but you could get like a ham or a turkey, Omaha steaks, and the way that it's working when it comes to my home is I'll get a delivery, and each delivery is maybe 3 more weeks out from the next delivery. So as soon as I get one delivery, I have to make another one.
Yeah.
So it's difficult to get, staples like milk and bread, things like that. They're very hard. I have had some neighbors that have been very kind and have dropped off stuff. My husband now, because he is so repeatedly exposed, does not go into the stores. He doesn't want to expose anybody else, even with a mask and gloves on.
Yeah.
So if I can get something through a service, that's how I'm doing it. Cost-wise, it's a lot more expensive.
Yeah. Yeah. What are some other challenges that the visually impaired community is facing under COVID-19 that the average person wouldn't think of, right? The average sighted person wouldn't think of.
I think the biggest thing is just information, because a lot of people who are blind or visually impaired, we cannot read PDFs. So if you're sending out a poster about hand washing and you want us to know about it, and there's no image description or there's no alt text used in any type of social media capacity, then we don't know what we're looking at. So that is very frustrating. The other thing is as people social distance, people are less likely to maybe offer you help if you're in a store and you can use a cane to get out. The transportation, as I had mentioned, is a very, very difficult factor. If you're now waiting for a ride share like Uber or Lyft, it takes forever. If you go on the subway or a bus, you know that you're taking your life in your hands in many, many capacities. And, also it's difficult to get PPE. You can't get the gloves, you can't get the masks.
Yep.
Most people who become blind or visually impaired do become so in two different ways. One is congenital, you're born that way. The other way that you become blind or visually impaired is acquired. So, you acquire it. I acquired my vision loss through my breast cancer. There have been people that I know in the community who have acquired vision loss through open heart surgery or a auto accident, head injury, different things like that. So it's very runs the gamut as far as how people become or come into this life. We're also not getting services from the people that maybe would be coming out to the home. If you're in the middle of getting training for cooking classes with your adult daily living skills instructor, well, they're not coming out. And if you need to do a Zoom class and you can't see anything, then that's really not going to be helpful.
Yeah.
All the guide dog schools have been very greatly affected. You have people that have been waiting, at some cases, a year or two to get a guide dog. And now these dogs are sitting there and they will not allow people to come in and train with the dogs, because to train with an animal takes about 3 weeks from start to finish. And you have to go live at whatever school you are going to. Now, my dog came from Guiding Eyes for the Blind, which is in Yorktown Heights, New York, and they've suspended all classes. So, there's going to be a big backlog, a very, very big backlog in a lot of these services. And I personally just feel that the disabled are at a larger disadvantage than the able-bodied, more so than ever before. And I wonder, God forbid, what would happen if one of us ended up in the hospital? Would we be given a ventilator? Are we considered less than? Would you give a ventilator to somebody that wasn't blind before you would give it to somebody that was? I mean, I think that really goes to a more of a faith-based, kind of spiritual question as far as moral injury, right? We've examined moral injury so many times with our veterans that are coming home, our veterans who have been in combat. Now we have these doctors, these nurses, the medical community. There are going to be a lot of issues of moral injury, and just how that is going to impact these people going forward. And I wonder if, God forbid, I was to get COVID-19, if I could, fall prey to one of those difficult decisions because of my vision loss and my cancer diagnosis.
And that's one of the saddest things that we've been talking about, and I've been thinking about a lot as far as the theological resources, right? The ethics behind all of this, right? There's a lot of theological thinking about the issues of end of life and beginning of life, right? But what the actual decisions, right, of who gets a respirator, right, who gets these privileges, when do we open up the country, right, how many lives is worth sacrificing for the sake of the economy, which are insane questions. 2,000 years of church history, and we don't have, because who would have thought that we would be sitting in a place, right, where we have to say how many people is it worth that, sacrificing for the sake of our economy, which, I mean, to us, it should be, it should be a no-brainer. It should be zero, right? It should be.
It's very, very difficult, and I have had many conversations even with my oncologist about what's been going on. And he has said to me repeatedly that even if they find some temporary Band-Aid to the situation, we really will not be protected until there is some type of vaccine. And that could be on the further out of 18 months. So I am presently already looking for a homeschool option, a kind of a full program for my children for next year. I don't think, given my cancer diagnosis and my visual disability, that I can take the chance of enrolling them in school, and having them go out into the community and come back. That weighs on my heart, like I cannot tell you. I feel for my children. I know they're going to miss, the socialization aspect of school, but the ultimate goal is to be able to be there as a mother throughout the duration of their life. And, this too shall pass.
Yes, yes.
Yeah.
And the comfort you can take is that obviously not all of us will go through this at the intensity that you're going through it, right? But all of us are making it up as we go, right? Like I got three kids who they're supposed to be sending every week. They send stuff from schools, but I see them being done in less than an hour, and the rest of the time I don't know what they're doing.
What they're doing? Yes. Yeah. I mean, even myself, like my kids never had tablets before this happened. I never let them use any of the technology. I grew up in the 80s, and I always felt like we didn't have that, and we turned out just fine. At least some of us did. So, I just want to make sure that, they're not getting too much of the screen time. Now what I'm finding is that I'm using the screen time both as an educational tool and quite honestly, sometimes just for a break. I don't think it's bad to say I need a break. And there are times that I have to have one. I really do. I really truly do.
Yeah, the analogy I always use is when you fly, they say put on your air thing first before you put it on a kid, right? This is the situation we're in, right? This is a national emergency. You need to take care of yourself, right? Otherwise you can't be there for them. You lose your temper, you'll be yelling at them, they'll get mad at you, you'll get mad at them, and it's just a cycle that spins out. So,
and I think, too, people have to remember that this is also not the time to judge another person's parenting. There have been a lot, people do that anyway, but it's such a sensitive time. I have seen so many obnoxious posts on social media about parents who, have said, I'm not having them do anything for school, or, I just put them in front of the tablet all day, or, I'm yelling at my kids. And, you just really, can't judge what's going on. You don't know what's happening in somebody's household. You shouldn't anyway, but especially not in the state of this pandemic that we're in.
Yes. Yeah. And with screen time, in Argentina, there's no time when the TV is not off, right? If you're home, the TV's on. That's how we grew up. That's how.
Yeah.
So I've already watched more. I watched more TV by the time I was 10 than my kids would probably ever watch in their lifetime. So I turned out okay.
You're doing well. So it's very different. It's different times. And I think when my husband comes back into the home, hopefully we're expecting him sometime in the middle of July. He's going to retire from the police department. It'll be a little bit easier, and I'll be able to kind of find some type of balance, with the schooling, at least to help them. I also think that if people believe that they can't school in the summer, then they're delusional, because, it's better to do a little bit, each week through the summer, keep their minds active, and especially with the stress, the emotional stress of what's going on psychologically, let them write their alphabet or read a book, or, do something academic, through June, July, and August. This is not the norm, but, they would have assignments regardless in the summer. We just have to do our best as parents to keep up with it.
Yes. And I would encourage you to focus on your writing, right? Make sure you carve out time to write, right? Because I've seen some of your blogs, I've seen what you've written. We need your voice. The world needs your voice.
I appreciate that. It's very, very hard. And I do, between trying to balance the DMIN, I'm also taking some CPE classes for my chaplaincy. It's difficult. I find myself writing a lot more theological, type of work now than ever before. I also do a lot of book reviews. So I get to read some really great stuff, as long as it's accessible to me, for the the Journal of Theology, and the Journal of Pastoral Care. So those are things that I enjoy, but I have to get back working on my website a little bit. You know, there's just always something.
Well, when I told the faculty we were doing this, recording this webinar, and they all told me you were a superstar. Dr. Reyes and Dr. Mason spoke, very, very highly of you. And now I know, porque sos Argentina, hija de Argentina.
Oh, that's why. That's exactly right.
Claro.
So, I told my husband that I was going to fly the Argentine flag outside my house, and he said, "No, you're not." I said, "Yes, I am. I'm going to get a flagpole, and I'm going to fly it." My father would be very, very happy. So it's I'm definitely going to do that. I remember doing a project when I was a little kid about Argentina. See, you know, for people like me that are very, very fair-skinned from that, you know, and light-eyed from that part of the world, when people hear you say, "Oh, I'm Latina," you know, "I'm from Argentina," or, you know, "Your father is Latin," they don't believe you. You know, it's quite funny.
Yeah.
You know, and my girls, I mean, my husband's Irish, they're very light skinned, but you know, one of the beautiful things about Argentina is just like the palette of all the beautiful skin tones. You get people that are very dark, people that are very light, you know. It's definitely something to admire. But
somebody like me, I go around saying I'm a Latino, and people look at me like I'm crazy, but
and I can't even see you that well to even see what you look like. I could just make out your dark hair from my vision.
No, I was born in Taiwan. My family's from Taiwan.
Oh, wow. Okay.
Yeah, so I look 100%. I am 100% Asian. So and my kids look 100% Asian. But every World Cup they have the Argentinian jersey. They really
they have the Argentinian flag. My kids have that too. They also have the one from Donegal. They like the Irish soccer players as well. So it's a little bit different. You know, I didn't talk about the chaplaincy as far as with doing the funerals.
So yeah, tell us about the chaplaincy work and how that came about.
So we actually live, quite frankly, right next door to a Catholic cemetery. And what's been happening here on Staten Island is a lot of our priests are totally overrun. They're very elderly. We do usually have at least 2 clergy members per Catholic church, and in some cases, 1 deacon. But the deaths have just been immense on the islands, especially from our seniors. And we've had a lot of people who have passed away that maybe don't have ties to one particular parish. And the parishes are going to give, you know, priority to somebody that passed away from their home parish. I mean, that's just usually what's done regardless. So I had gotten a call from somebody at the cemetery asking me if I could perform the Rite of Committal, which for Catholics is basically a graveside prayer service. And because of my cancer, I really can't go, you know, near anybody or go near the grave. And quite honestly, as a chaplain and as a woman, I didn't even know if I was allowed to do that. I had no idea. It wasn't something that I had ever really thought about or considered, despite living next to the cemetery. So I ended up calling our deacon at the parish, and he said, you know, absolutely. He said, you can, you know, perform that, as well as a funeral director would be able to perform that particular rite. So I said, okay. I said, I'll do it. I don't know if I did it correctly. I felt very out of place doing it. It's not something that I ever foresaw myself doing. I don't consider myself a minister or a pastor. When I went into chaplaincy, it was because I thought it was such a great marriage between my social work background.
Yes.
So many times, you know, you have people that want to discuss a spiritual lens, you know, to their life, but unless they bring that up as a social worker, I can't touch that, you know, and that's just part of my legal licensure, you know, kind of credentials and agreement. So to be able to be a chaplain was something that I was really happy to do. And I think that it was a good fit, you know, for my life, especially with the DMIN. Now doing these services, to do them on my back porch. I mean, you want to talk about breaking up a day, you know, they'll call me from the cemetery or from a funeral parlor, and they'll say, listen, can you do a service at 9:30 and one at 2:30? I never know the individual's name. All I know is the age and their gender. And most often than not, there's either 1 or 2 people that will come, you know, to the service because of social distancing and New York State laws. So there is an empty lot on my, sorry, I don't know why that keeps happening. There is a empty lot next to my house where there used to be another home that had been knocked down. So the people stand there. and they bring the hearse into the cemetery parking lot, and I usually just say the prayer right there. In some cases now, I've had people who aren't even being buried in this cemetery that I live next to. They're being buried in some other location across Staten Island. So for those, I do those in front of my house. So instead of using the backyard, I go to my front stoop and I do it there, maintaining social distancing, and they will pull the casket out of the hearse. I'll say the prayer for the people. They are always very, very grateful, but I'm definitely attracting a lot of attention from neighbors, because they don't know what's happening. You know, I don't go around advertising, you know, that I'm in seminary school. It's not that I'm not proud of it, you know, but I know a lot of people, when they hear that, that really thinks, you know, has them think about, you know, well, this person maybe is very pious, or maybe it's something that I didn't know about that person. People don't equate social justice or community with seminary. And that's something that I'm really hoping that that will change, because that for me is more my ministry than, say, you know, being a pastor at a church, you know, every Saturday or Sunday.
Yes, absolutely. Yeah, and what NYTS is trying to do now, what we're starting to want to do more of, is the work of advocacy, right? Because a lot of faith leaders are really good at the service part, at the preaching and service part, but not so good at the advocacy, right? Who do we even go to, right? And especially with the NYTS community, so many of our members of our community are the ones who are dying, right? The Black and Latino community are the ones who are most affected by by this, right? And so we want to start this advocacy group. So I'll definitely let you know. I'll be talking to you a lot about.
Oh, I would love that. I mean, you know, that's
disabled. Yeah.
Like the disabled community has long been in every aspect of theology so significantly underserved. But I specifically remember doing my MSW and reading an article that was about the rate of asthma in public housing in New York City with African American communities. And you look at that, and you look at this virus and how this virus is really attacking people that have asthma, attacking people that have diabetes. Where does that all stem from? You know, I mean, just these patterns of poor housing, you know, poverty, lack of a two-parent household, I mean, lack of education. I mean, it just goes on and on and on, as you know. So it's a very, very difficult, scary time, you know, for sure.
Yeah. So, well, thank you so much for your time, Holly. Thank you for sharing your time with us and your experience. And I knew it was going to be inspiring, but it was more than I thought. I was more inspired than I thought I was going to be.
Thank you. Thanks so much for having me. And I'm so glad that I met another fellow Argentinian, because that doesn't happen too often.
I know, when we can get together, we'll have to get together for asado. Asado y un matecito.
And chimichurri. I'll have to have some good steak.
That's right.
All right, Tony. Thanks a lot.
Okay, Holly. Thank you so much.
All right. Talk to you soon. Bye.
Okay. Yep. Bye-bye.